The bill be considered as read and open for amendment at any point. The chair now recognizes the gentlelady from Wyoming, Ms. Hageman, for an opening statement.
Thank you, Mr. Chairman. I speak in favor of H.R. 3492, the Protect Children's Innocence Act. Mr. Chairman, today we are facing one of the greatest crises of our time, child abuse disguised as medical intervention. Children are being coerced by adults in positions of authority into life-altering gender transition procedures without a full understanding of the meaning or impact. Democrats have embraced an extreme position on gender and the biological differences between boys and girls and men and women. They are clearly more interested in promoting radical leftist policies than protecting children from harm. The radical left has deliberately distorted the public debate surrounding what they refer to as gender-affirming care, which is really nothing of the sort. Instead of accurately describing the procedures as harmful, life-altering, and barbaric, which they are, the left deceptively frames the procedures as being necessary to improve the health and well-being of children. By advocating for these procedures and this level of medical intervention, Democrats are indoctrinating children and encouraging them to make life-altering decisions about their body involving hormones and surgery, jeopardizing their health. Let's call this for what it is. So-called gender-affirming care is the genital mutilation and chemical castration of children. It is not life-saving care, it is child abuse. All evidence points to the fact that these barbaric procedures, including puberty blockers, hormones, and surgeries, are a form of genital mutilation. More and more individuals who were convinced to go down this road are now coming forward to share their horrific experiences of being used as experiments of the medical establishment. The majority of these brave individuals are girls and women. The first rule of medicine is do no harm, yet those in the medical community performing these grotesque procedures on children are committing serious harm. Thankfully, doctors across the United States and in other countries are also beginning to take a stand against those in the medical community who insist that these are, quote, life-saving procedures and should not be questioned. Thankfully, my friend and colleague, Representative Marjorie Taylor Greene, stepped up and introduced the Protect Children's Innocence Act. I thank Representative Greene for her important work on this legislation and for her tireless efforts to protect our children from this evil. The Protect Children's Innocence Act will hold those accountable who perform or attempt to perform genital mutilation or chemical castration on children. The bill expands covered offenses to include the bodily mutilation and the chemical castration of a minor. Victims are protected by ensuring that they cannot be arrested or prosecuted if one of these or other prohibited procedures are performed on them. This issue is really quite simple. Do not force children into making decisions they will not be able to reverse. Do not make these children lifelong patients dependent on the medical system. A civilized society protects its children first, and that is what this bill does. In short, do not abuse our nation's children. I urge my colleagues to support this legislation, and I yield back.
Gentlelady yields back. The gentleman from Maryland is recognized.
Thank you very much, Mr. Chairman. We know that one of the basic tactics in every authoritarian's playbook is to pick out a small minority group in society and scapegoat them, castigate them, demonize them, deny them basic rights and freedoms, dehumanize them, deny their very existence. Jews and Gypsies in Nazi Germany, Christians in Pakistan today, African Americans in Jim Crow America, gay people in Putin's Russia, Uyghurs and Tibetans in China. Just pick out a minority and mobilize the society against them, and you won't have to answer tough questions about your own authoritarianism, your own corruption. Mr. Chairman, I had a very disturbing meeting at the beginning of this Congress with parents of transgender kids who came to see me from my district. And I was prepared for them to be lobbying me on this or that, and I began to talk about different legislation, and they said, no, we know that you're with us on the legislation. We're here to ask you how far you think this campaign is going to go, because a lot of families have started to leave the country and are talking about leaving the country, going to Spain or Portugal or France, somewhere where their families can feel safe. And so I was so taken aback by the conversation and their true alarm and what they're reporting about their kids that I have followed this issue very closely since the new administration started. And indeed, the campaign of demonization and vilification and scapegoating began on the very first day in office. President Trump issued an executive order denying the very existence of transgender Americans. That's an order that George Orwell would have recognized well. He purged government websites of any reference to transgender Americans, just disappearing them. He issued an executive order directing that Americans serving honorably in the armed forces for years or decades be summarily kicked out for being transgender. That's right, a guy who avoided military service himself because of his serious problem with bone spurs and who told Howard Stern that his Vietnam was trying to avoid sexually transmitted diseases at the discos and clubs of Manhattan, is now kicking out of the military thousands of honorable, patriotic Americans, more than 1,000 at least, who've already been kicked out, people who have faithfully and bravely served their country because of Donald Trump's intent and determination to scapegoat these people. He's threatened to defund schools just for supporting trans students. He's trying to bully schools into banning trans girls from playing sports with other girls. And understand what the Biden policy was. The Biden policy was to leave it to the school districts. No categorical ban on transgender kids across the country, across different school districts, but it's up to each elementary school, middle school, high school to work out those issues for themselves. Trump's ordered transgender women incarcerated in women's facilities to be immediately transferred out and placed in male facilities, putting their bodily safety into jeopardy. Today, during Pride Month, no less, which is not to imply that our colleagues are necessarily celebrating Pride Month, but our colleagues go one step further now in this cruel campaign. They seek to deny transgender youth access to potentially life-saving health care, access to the treatments and medications prescribed to them by their physicians in accordance with the wishes of their family, their parents. And they do this while they try to pass the big, beautiful bill that will cut health care to more than 14 million Americans. For the life of me, I don't understand how a party which prides itself so much on the individual's right to make his or her own decisions, the family's right to make the decisions for their own kids, so much so that they would reject the obligation of anybody to get a vaccine in the country at this point for any purpose. I understand it's a principled position. Now you want to say that you're going to make a decision for a family and their kids about how they're to be raised and what health care they need? Big Brother loves their children more than they do? Is that what you're telling us? I mean, give me a break. The so-called Protect Children's Innocence Act, introduced by that famous advocate of public health and children's safety, Marjorie Taylor Greene, would make it a crime for doctors just to care for their transgender patients in accordance with the wishes of their families. All major medical associations in America agree evidence-based gender-affirming care is necessary and in many instances life-saving for transgender youth. And while my colleagues across the aisle today will likely tell you there are young people across the country being mutilated by evil, malicious doctors, that is not the real story. Like all medical care, gender-affirming care is tailored to the age and the unique needs of individual patients in consultation with the families, medical doctors, mental health professionals. And I'm sorry, I trust them more than I trust Marjorie Taylor Greene, who has shown nothing but a spectacular disrespect for scientific professionalism and expertise in the United States of America. Let's not turn the Congress of the United States into a supreme medical board for the country that will override not only the states and the localities and the medical associations and the physicians, but even the wishes of the parents. I wish one of my colleagues would explain that to me, how you expect Big Brother to make better decisions than the families of the kids involved in this situation. It is to elevate your ideological dogma over the needs of real people. Let's stop attacking transgender kids. Let's instead fight to support the programs all of us need. My colleagues voted for a bill that threatens health care for over 37 million children who rely on Medicaid and CHIPS, the Children's Health Insurance Program. They supported cutting benefits for nearly 15 million children who rely on SNAP benefits to get adequate nutrition in America. They want to gut the Department of Education, which ensures nearly 26 million low-income students and 7.5 million students with disabilities will have access to meaningful educational opportunities. If we want to talk about children in America, let's talk about children in America. Let's not demonize and scapegoat less than 0.5% of the population. Somewhere around 1 million people in America are transgender. So let's not pounce on them and demonize them and vilify them and the people who love them and who are trying to take care of them. This so-called Protecting Children's Innocence Act from Marjorie Taylor Greene is the latest effort to attack, demean, scapegoat transgender Americans. I won't stand for it. I urge all of our colleagues to oppose this, and I yield back.
Without objection, all other opening statements will be included in the record. The chair now recognizes the gentlelady from Wyoming to offer an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
The clerk will report the amendment.
Amendment in the nature of a substitute.
Without objection, the amendment in the nature of a substitute will be considered as read and shall be considered base text for the purpose of amendment. The chair now recognizes the gentlelady from Wyoming to explain the amendment.
Thank you, Mr. Chair. This amendment clarifies the definition in the health of the minor section of the bill, and it also clarifies that necessary medical procedures are not defined as mutilation. I urge support for my amendment, and I yield back.
I thank the gentlelady from Wyoming. Who seeks recognition? The gentleman from New York.
Thank you, Mr. Chairman. Move to strike the last word.
The gentleman's recognized.
Thank you, Mr. Chairman. Mr. Chairman, this bill is a disgrace in a long line of disgraces. It outlaws gender-affirming care. Gender-affirming care we know to be life-saving procedures. The suicide rate of transgender teenagers who are denied this care is sky high. We started out with the president's executive order denying the existence of transgender people. They don't exist, but they obviously exist enough to be kicked out of the military, not categorized in male. Now, if you say there are only two sexes, males and females, then the males in the military who are transgender should have been declared males and kept in the military. Instead, we kick them out. That doesn't make sense. It's just an exercise in prejudice. And who are we to dictate to families and doctors as to the proper medical care for their teenagers? We know that the suicide rate of trans teenagers who don't get gender-affirming care is very high. It is and this bill would make it a crime to properly treat transgender people. The medical societies recognize the transgender as a category. We know that there are not just two sexes, male and female. For decades, it was criminal to be gay, to be homosexual, to be lesbian. And people were subject to blackmail for that. Just watch The Manchurian Candidate, good movie. We know better than that now. So why don't we know better than that about transgender people too? We have to open our eyes and see what's in front of us. Enabling families, troubled families, to go to their doctor and say what's wrong. And the diagnosis is that this kid is trans and needs gender-affirming care. If they decide to do it, who are we to tell them not to? Are we a dictatorship? We dictate to families? That's what this bill would do. This bill is a disgrace. It is Big Brother. The Republican Party supposedly is the party of small government. And here it is saying that Big Brother knows better than the family the family doctor. That is not right, and we shouldn't pass this bill. And I'll yield to the Mr. Raskin.
And I thank the distinguished gentleman from New York. I wanted to enter for the record a unanimous consent request. This comes from the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Osteopathic Association, and American Psychiatric Association, titled Leading Physician Groups Oppose Infringements on Medical Care Patient-Physician Relationship, dated May 1, 2025. And I want to just quote a paragraph. Our organizations have consistently opposed any legislation, regulation, or executive action that interferes in the confidential relationship between a patient and their physician or undermines the provision of evidence-based standards of patient care and physician training and education. Patients must be able to discuss health issues with their trusted physician to determine together what care is best for them. They make a very powerful argument against what Marjorie Taylor Greene wants to do in this bill. And I must say, Mr. Chairman, in requesting UC, I trust the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of OBGYNs, the American College of Physicians, the American Osteopathic Association, American Psychiatric Association, than I would trust, before I would trust Congresswoman Marjorie Taylor Greene.
Without objection or
Reclaiming my
surprise.
time. The gentleman has recited the list of just about every medical society in the United States. And this committee, through this bill, proposes to execute our judgment, a bunch of politicians, over all the medical professionals, over all the societies representing medical professionals in this country. If it weren't for the fact that doing so would hurt many people, would cause many suicides, this would be laughable. Mr. Chairman, I yield back.
Who seeks recognition? The gentlelady from Wyoming.
I can understand why there are some in the medical field that support these kinds of procedures. They're huge moneymaker opportunities. Recently discovered video from 2018 revealed a Vanderbilt University Medical Center doctor touting the pediatric gender-affirming procedures are, quote, huge moneymakers for hospitals, and a staffer saying anyone with a religious objection should quit. The video further featured a doctor hyping the profits hospitals can make from performing medically unnecessary double mastectomies on young girls. Such a vile procedure is widely referred to as top surgery in the contemporary language of transgender ideology. The fact is, a growing number of experts in Europe and elsewhere are proposing that there is limited existing evidence that supports gender-affirming treatments in children with gender dysphoria. For example, the National Health Services of England and the Swedish Agency for Health Technology Assessment and Assessment of Social Services conducted 2 recent systematic reviews to assess the evidence of the effectiveness of hormone therapy, puberty blockers, and gender reassignment surgeries in adolescents with gender dysphoria. The 2021 and 2022 studies determined that, quote, the scientific evidence is insufficient, end quote, to accurately evaluate the effects of these treatments in minors, though both studies concluded that there is some support to suggest that the hormone given to delay puberty, GnRH, may inhibit normal bone development in children. In fact, what we know is that this particular drug carries risks of significant harms, including infertility, sterility, sexual dysfunction, impaired bone density accrual, adverse cognitive impacts, cardiovascular disease and metabolic disorders, psychiatric disorders, surgical complications, and regret. So yes, it makes sense for those in some in the medical field to pursue this because, as they've indicated themselves, as they've admitted, they can make massive amounts of money by undertaking these absolutely brutal type of treatments on minors, no less. And what do I mean by the brutal types of treatments? I'll read some of them to you. It's not not just, quote, top surgery that can make the hospitals money. These doctors shockingly boasted about lucrative, quote, bottom surgeries. What an interesting euphemism we have here. And promoted the money to be made on phalloplasties performed on girls. These, quote, bottom surgeries for girls nonsensically claimed to help masculinize gender affirmation and involve numerous high-risk procedures, including creating the penis, lengthening the urethra so that a biological female is able to stand to urinate, creating the tip or glands of the penis, creating a scrotum, removing the vagina, uterus, and ovaries, placing erectile and testicular implants, and skin grafting from the donor tissue site. Isn't it nice that they refer to this as, quote, bottom surgery? When I talk about this as being barbaric, I think that's actually an understatement. And I can see that in a couple of years, we're going to look back on this period of time, and we're going to be absolutely horrified that we allowed people to do this to our children, that we allowed them to make these decisions for children so that they could have these kinds of surgeries and medical intervention. So yes, it is not surprising to me that you have some in the medical field that want to continue making money. And the younger the patient that they can bring in, the more money that they can make. Because once you start down this road, you will be a lifetime medical patient, both in terms of the psychiatric care that will be necessary, as well as the pharmaceutical intervention that will be necessary, and the ongoing surgeries that will be necessary, in addition to, as I've indicated, having problems with cardiovascular disease and metabolic disorders. With that, Mr. Roy, I will yield the remainder of my time back to you.
With that, I'll now recognize Ms. Garcia. Okay, Mr. Johnston.
Thank you, Mr. Chairman. I rise in strong opposition to this bill. I strongly oppose this bill because it's an extreme attack on parents, on doctors, on science, on freedom, on liberty. This bill would throw doctors in prison for providing medically necessary care that is supported by every major medical and mental health association in the United States of America, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association, among others. And not only that, this bill would throw parents in jail if they help their child access evidence-based treatments from a medical professional. When a child is suffering and needs medical care, I want them to get the treatment that their parents, and their doctor believe is best. There's no space in that exam room for a MAGA Republican politician who wants to deny appropriate medical care from your kid out of either cruelty, ignorance, or both. This bill shows Republicans' hypocrisy. It allows puberty blockers and hormone therapy for cisgender youth, just not for transgender youth. That's because Republicans want to target and demonize trans kids. And that targeting has real consequences because gender-affirming care has been shown to decrease the dramatically high rates of suicide and depression for transgender and gender-diverse youth. We need to be giving kids the tools to thrive, not taking away their health care as a political ploy. I was proud to join an amicus brief in the pending case of United States v. Cmte, which highlights the role animosity has played in legislation banning medically necessary care for transgender youth, and urging the Supreme Court to strike down the Tennessee law at issue in the case. Because this bill ignores science, puts young people's lives at risk, and criminalizes doctors for providing appropriate care, I urge my colleagues to oppose this bill, and I yield back.
Gentleman yields back. Is there further discussion? Mr. Orton.
Thank you, Mr. Chairman. Since my first week in Congress, I've been calling for federal action to dismantle the transgender industrial complex. One essential step is defunding sex trade altering treatments on minors. During the Constitution Subcommittee's hearing on Congressman Green's bill, I spoke about the costly sex-altering treatments that are being paid for in some states by the Medicaid program. I led a letter to CMS trying to quantify how much U.S. taxpayers were spending on this grisly activity, but pinning down that number is difficult because of the rampant fraud and abuse in billing and coding for these procedures. For instance, these transgender clinics billing for precocious puberty or hypogonadism, when really they are using those drugs for gender transition. It is essential that we preserve the language in the House passed one big beautiful bill that defunds mutilating and sterilizing sex trait altering treatments in Medicaid. Our Senate colleagues must preserve that language. As medical doctors, we take an oath to do no harm. There is absolutely nothing evidence-based about chemical castration or genital mutilation of children. The Dutch protocol and the WPATH guidelines are garbage. 3 systematic reviews in the UK, the US, and Sweden have refuted and shown the utter scientific nonsense embodied in the Dutch protocol, basically the protocol that's being cited by my Democrat colleagues today. The reconciliation bill reflects the thrust of one of the first bills I introduced when I came into Congress, H.R. 2387, the No Harm Act, along with which contains the defunding of transgender mutilation, as well as conscience protections and a private right of action for those harmed by this grisly industry. Over the past few years, so-called doctors working in pediatric transgender clinics have prescribed medicines or done procedures they know will permanently sterilize children and leave them with irreversible psychological and physical damage. This is done in service of their poisonous gender ideology. They also exploit vulnerable children and young adults, often those suffering from anxiety, depression, autism spectrum disorder, or are victims of domestic violence. They promise these poor young people that their problems will go away and they will be happy if only they embrace gender ideology and undergo gender transition. These so-called doctors do this in service of their sick ideology, and as one of them put it, because the procedures are big money makers. The No Harm Act codifies President Trump's Day One executive order and protects taxpayers from being forced to subsidize the abuse of the vulnerable. Another federal solution, of course, is before us today. This is to hold the quack doctors accountable for performing these horrific treatments on minors. Congressman Green's bill does so by instituting criminal penalties on anyone who performs sex trade altering treatments on minors. This so-called gender-affirming care is clearly child abuse. In 2021, 4,000 Americans aged 6 to 17 began cross-sex hormone treatment for gender dysphoria. Most of those 4,000 children didn't even know at the time they were signing up for a lifetime of fertility issues and other serious health problems. If a child takes puberty blockers before beginning hormone therapy, they will not develop gonadal tissue or gametes, resulting in permanent loss of reproductive capacity. We do not even let children get their ears pierced without better informed consent than this. There is also a long list of side effects in addition to infertility. I'm proud to support the Protect Children's Innocence Act of 2025, and I yield back.
Gentleman yields back. Is there further discussion? Ms. Jaya.
Thank you, Mr. Chairman.
Sorry, Mr. Garcia.
Thank you, Mr. Chairman. I move to strike the last word.
The gentleman is recognized under the 5-minute act. He doesn't need to strike the last word.
Thank you. I join the Democratic colleagues in strongly opposing the criminalization of gender-affirming health care for minors. This bill is a shocking overreach, even for a party that does nothing else except overreach. It ignores science, it endangers young people, and criminalizes doctors for doing their job. The reality is that every major medical and mental health association, as has been shared, in the country supports age-appropriate, gender-affirming care for transgender people. And like other kinds of health care, Congress should not be in the business of dictating medical decisions. And far from protecting young people, this bill only continues the Republican Party's ongoing war against the most vulnerable communities in our country. Criminalizing gender-affirming care will only stigmatize and endanger the lives of young people who should be making sensitive medical decisions in consultation with their medical providers and parents or guardians, not with Marjorie Taylor Greene. But this outcome isn't a coincidence. It's exactly what Republicans want to do. As they have done in states around the country, Republicans pretend to be protecting children when they're just punishing medical providers, caregivers, and the children themselves. Let's take a step back and just think about how absurd it is to be prioritizing a bill like this right now. Trump has tanked the economy, declared a war on immigrants, repeatedly violated the Constitution, and directed Republicans in Congress to destroy Medicaid, food assistance, and Pell Grants, to give hundreds of billions of dollars to ICE and the richest people in the country. Instead of even pretending to defend liberty, freedom, and small government, Republicans are rushing to embrace deportations of U.S. citizen children with cancer, the militarization of our communities, with violent suppression of speech and dissent, and the persecution of the most vulnerable amongst us. And it's only going to work if we allow it to. In this moment of authoritarian overreach, people across the country must stand together in solidarity. We must reject this administration's civil rights violations against people of all backgrounds. We must not fall for the trap and believe that the source of our problems is trans people, immigrants, and young people. Because the real problem is billionaires and politicians who are happy to trample on the Constitution and make a quick buck off of it and the backs of the working class. Let's keep the focus on them and stop them from destroying our country while we still can. Thank you, and I yield back.
Gentleman yields back. Is there further discussion? Ms. Hageman.
Yes, Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3492, offered by Ms. Hageman of Wyoming. Page 8, line 19.
Without objection, the amendment be considered as read. Gentlelady from Wyoming is
I
recognized.
reserve the point of
5
order,
minutes.
Mr.
This
Gentleman reserves
amendment
the point of
simply
order.
strengthens the definitions of biological sex as well as the definitions of male and female in the legislation, and I urge support for my amendment, and I yield back.
Gentlelady yields back. The question is on the amendment by the gentlelady from Wyoming. Is there further discussion? Is there discussion?
But perhaps the introducer of the amendment could explain what the purpose of the amendment is.
I can. As I said, it strengthens the definition of biological sex, and then also it further defines male and female. As you can see, it would insert these definitions on page 9 after line 18. Identifying male means a person who naturally has, had, will have, or would have, but for a congenital anomaly, historical accident, or intentional or unintentional disruption, the reproductive system that at some point produces, transports, and utilizes sperm for fertilization. For female, the term female means a person who naturally has, had, will have, or would have, but for a congenital anomaly, historical accident, or intentional or unintentional disruption, the reproductive system that at some point produces, transports, and utilizes eggs for fertilization.
Mr. Raskin has the time.
Okay, but I'm no expert in this amendment, so I'm not quite sure if the gentlelady would just yield for a quick question. Is there some particular scientific provenance for this definition? Is it? Yeah.
That what's funny is if you just read the definition, I think that it is something that we probably all learned in high school biology. For far too long, Democrats have been pushing dangerous gender ideology on children, claiming that you have a sex assigned at birth versus sex that you may identify with. This is leaving children more confused about basic biology and leading them down the path of life-altering decisions.
Okay, reclaiming my time here. If I'm reading the definition correctly, and again, the gentlelady has not clarified where it comes from. I don't know which medical association or scientific group came up with this, but this seems to be perfectly consistent with people being transgender. It says the term male means a person who naturally has, had, will have, or would have, barring congenital anomaly, historical acts. So I don't know. Again, we haven't had any hearing on this, but this doesn't seem to be incompatible with there being transgender people, which obviously there are. There seem to be more than 1 million of them in the country.
This is the definition of male and female included in the bill.
Well, again, is there any scientific basis for this, or did you just offer this one?
Well, it's so obvious that so many times the Democrats are unable to define men and women. And so that's what we've done. We've defined male and female.
All right, well, if you're the expert, you tell us where you got this information.
We've defined it in this bill.
Okay, so in other words, it's a creation of the GOP staff of the Judiciary Committee?
I think that this is a biological definition of male and female.
From where? Yeah, it already says biological.
Right.
Physician would be.
But you're amending a bill which already has the language of the biological definition. It says the term biological sex means the indication of male or female sex by reproductive potential or capacity. Sex chromosomes and naturally occurring sex hormones, gonads, or internal or external genitalia present at birth. Well, I mean, what is your problem with that definition? I'm not necessarily opposed to yours. Yours seems to be much more embracing of the transgender idea than the other one does, but I'm just curious where it comes from if we're going to proceed on the basis of science.
This was what I was provided as far as the amendment for the bill.
All right, well, thank you for that inquiry that you made into it. I think that people's privates should be private. I'm a little embarrassed by a lot of the conversation today, and I think all of this is unnecessary, and all of it is a massive intrusion into the private family life of the patients, states' power to regulate medicine, and the medical associations that have actually worked on this. So I'm not quite sure which of these two definitions is superior to the other. I'd be interested to know whether anybody has any scientific basis for it. I mean, I'm happy to yield to anybody. Perhaps Ms. Valiant could help me out.
Oh, well, a question that I had is that I noticed that what my colleague has brought forward does not acknowledge at all the fact that there are intersex people who are born with sex characteristics that do not fit typical binary notions of male or female. And any doctor who is worth their salt will tell you that that is the reality, that there are intersex people living across this country that do not exactly fit your definition. So I want to know, where do they fit in? Do they not exist?
This bill isn't directed to that. This bill is the mutilation of children.
Reclaiming my time. Let me reclaim my time.
Allegedly,
Mr. Raskin.
Would the gentleman yield?
Mr. Chairman, look, the gentlelady from Vermont makes a very important point, which is there are people who are born with intersex genitalia. And she asked, where does this fit into this definition? Again, nobody has really clarified why this definition is superior to the one that is already in the bill. From my perspective, all of it is a massive invasion of privacy, and I'm just surprised that none of my colleagues has mentioned the word parent or mother or father today. If we're talking about vaccines for children, I think everybody would say that should be up to the parents. Why have the parents completely disappeared from the picture here? Is nobody interested in the parents? I mean, shouldn't we be trusting them to love their children a little bit more than Marjorie Taylor Greene loves them?
Gentleman's
Well, the
time has
gentleman
expired. Is there further discussion? Mr. Onder.
Yes. Will the ranking member yield?
Yes, by all means.
Yeah, I'm not sure. I believe, and I was just handed this definition myself, I believe that this definition covers a couple of things. I think it does cover the issue of intersex individuals who have congenital anomalies. Also, the part about the congenital anomalies could also include genetic abnormalities like Klinefelter syndrome, which is a male with YO chromosomes who are sterile, and of course Turner syndrome, which is XO, which individuals who are also female but sterile. So I believe that's the purpose of this definition.
Mr. Onder, would you yield?
Yes. I will.
For further clarification, this is the definition that was included in Dr. Marshall's Senate File 977 in the bill that he introduced, which was to prohibit taxpayer-funded gender transition procedures and for other purposes.
Does the gentleman yield back?
Could I answer the?
Well, the gentleman, Mr. Onder controls the time. Mr. Onder?
Mr. Onder, will you yield for a question?
Yes, I yield.
Thank you.
Yes, I yield.
So I mean, your question's a strong one, and it raises for me, how are we going to interpret and apply these definitions? In other words, let's say a person presents themselves to you. What would you do in order to determine whether they have gone through the congenital anomaly or historical accident or intentional or unintentional disruption and so on to qualify as a male or as a female? In other words, how does this improve upon asking someone, are you male or female? Right, yeah, that's my question.
Well, I think the point is that sex, male or female, is a biological reality. It's not a social construct or a psychological construct. It's not. Sex is sex. There are males and females, and that is
And
what
intersex, which is my
this
point.
law. Well, folks who are intersex or male or female, they have congenital anomalies, but they are.
Will you yield for a question, Mr. Onder?
I will yield.
What time is it? I'm sorry. So, in good faith here, I'm trying to engage with you in a colloquy, because I do not understand. So you're saying there are intersex people, they have sex characteristics of both male and female, and the question goes to the heart of who is deciding that? Who is deciding how they are presenting? So you're going to tell.
It's usually decided by genotype most often, and again, there are abnormal genotypes like
No. I'm
like
saying
XXY,
no. If I
Klinefelters,
could, I want to get back to.
Turners.
No, I'm asking you a serious question here. I'm asking you a serious question.
I'm giving you a serious answer.
But is that person who is presenting with both characteristics? Do they get to decide how they are presenting in the world?
Well,
If
I decide tomorrow that I am a woman, I'm still a man because
I'm talking about
I
intersex
meet
individuals.
this definition.
I'm talking about intersex individuals. That's what I'm talking about here. Are you deciding for them?
No,
Who's deciding?
There is a biological reality that this definition would recognize.
Well, I disagree, but I appreciate you
If
attempting
the
to
gentleman
answer
would
my
yield for one follow-up on that.
Yes.
So I accept your position that it's a biological reality, although that departs from the language here, which talks about historical accident or intentional or unintentional disruption, which doesn't seem to relate to biological condition.
No, the historical accident would mean, for instance, if someone suffered a tragic accident that rendered them infertile. If that happened to a man, if it happened to me, I would be rendered infertile.
I got you.
I'd still be male.
So my question remains, though, say in the case of an intersex individual or somebody who is born infertile for different reasons, Who makes the decision? Who applies what you're describing as the biological standard? Who decides that? Is it the person and their family and their doctor, or is it the U.S. Attorney General, the U.S. Attorney for the district?
Well, I think what you're getting at, you're trying to get me to embrace your idea of this term sex assigned at birth, but there is a biological reality that the baby born is male or is female. They may have, this baby may unfortunately have a genetic abnormality like Turner's and be XO genotype, or Klinefelter's XXY genotype, or maybe have other testicular feminization, various other birth defects, but that doesn't change the fact that that individual is male or female. And this, I think that's what this definition covers.
Gentlemen's time has expired. Who seeks recognition? Question, it's an amendment, right? The question occurs on the amendment offered by the gentlelady from Wyoming. All those in favor say aye. Aye. Those opposed, no. No. In the opinion of the chair, the ayes have it, and the amendment is adopted. The question now is, who seeks recognition? Gentlelady from North Carolina.
Thank you, Mr. Chairman. And this has been kind of a mind-blowing conversation today, but I just wanted to share something that this bill and so many of the other bills targeting the transgender community, the effect that it has been having on our children. So I had a roundtable to talk about nutrition assistance and small businesses a couple weeks ago in my district, and it was just people sitting around talking about how to get more money for the food bank and for school nutrition and how to support our small businesses. And after we finished the roundtable, a woman came up to me with tears in her eyes and asked if she could talk to me. And I said, of course. And she told me that what is going on in Congress and with our president and the lack of any compassion for people who are transgender has caused her child so much distress that her child is thinking about leaving this country. And her child is transgender. And it feels like ever since this Congress has been in session and this president has been really exploiting that child's entire being, that they're not safe in this country. And then I started to cry, and I hugged her, and I said, I will go back to Washington and share your story. So I'm doing that today. Thank you, and I'll yield back.
Gentlelady yields back. Gentlelady from Washington is recognized.
Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment. Point of order reserved by the gentleman from Arizona.
Amendment to the amendment in the nature of a
The amendment will be
substitute.
considered as read. The gentlelady from Washington is recognized to explain the amendment.
Thank you, Mr. Chairman. This has been a bizarre conversation, and it's very difficult to engage with it if you're actually engaged in any kind of reality about what gender-affirming care is and who trans people are. And we've had all kinds of things be said here, words be used. Republicans are bringing yet another despicable bill that attacks the transgender community. And the gentlelady who introduced the bill is calling practices barbaric, but she can't tell us even where the definition she introduced came from. What is barbaric is this legislation. What is barbaric is targeting trans kids in this country who are not doing you any harm. Show me a trans kid who's doing you harm. And then tell me how many of you are parents that would do anything that you could to protect your kids and to make sure that they didn't commit suicide, that they were actually able to engage in the world in a healthy way. Tell me what you wouldn't do for your children. Because when you introduce legislation like this, it is not only stupid legislation, it is cruel, it is mean, and it interferes with your own conservative principles. You really want to take away the ability to allow parents to make decisions about their own kids' medical situation with their doctor? That's what Republicans want to do? Now, I know we're all inconsistent in different ways, and there are people on that side who have been consistent on issues of debt and deficit. Both of us on either side of the aisle have taken up issues of privacy. This is a giant inconsistency in the Republican Party right now. You are supposed to be the party of limited government that doesn't get in the way of parents making decisions for their own kids. Remember parental rights? Remember individual rights? But that's not what you're doing. And don't just take it from me. In 2018, when the anti-trans political attacks were beginning, Barbara Comstock, who is a Virginia Republican who served in Congress, many of us knew her, said, quote, "It opens a Pandora's box when you don't allow the parents and the doctors to make this decision." Who are you to get in the way of a parent making a decision about their own kid's health? And, you know, when you talk about, I wrote some things down as you were talking because this whole thing is ridiculous. You want to talk about the industrial medical complex in healthcare? Well, let's talk about that. Why don't we go after those for-profit private insurance companies that have taken over healthcare and made 1 in 3 Americans have medical debt? You want to talk about irreversible psychological damage, another thing that you over there are trying to say about our kids and what we make decisions about? Well, let's talk about cutting nutrition assistance. You want to cut nutrition assistance, $2 a meal from kids who are hungry. That's what your big bad betrayal bill does. You want to talk about irreversible psychological damage? Let's talk about child abuse. Let's talk about separating moms and dads from their kids, immigrants, locking them up indefinitely. That's what you just put in the bill that we voted through the Judiciary Committee. So what the hell are we doing here, Mr. Chairman? Let's be a little consistent and precise and stop attacking trans kids. That's all this does. Now, I do have an amendment here, but it was all, I just have been listening to this and I cannot believe what this conversation has been about. My amendment would allow medical professionals to continue delivering healthcare to young trans people when it is considered a best practice. It recognizes that this care is safe, widely accepted, appropriate, medically necessary, and most importantly, it allows transgender people to live safely and authentically as themselves. Any parent over there, do you want kids to commit suicide? Is that what you'd like? Do you want them to not get the counseling that they need? Because that's what gender-affirming care is. In very rare cases, there is surgery that is prescribed. But you guys make it sound like this is some giant, terrible thing that parents are doing for their kids. You're parents. Why are you getting in the way? Why are you letting government get in the way of parents making decisions about their own kids with their own doctors? It is absolutely outrageous, and you should, at a minimum, vote for this amendment. And the chairman is always generous with me because we have spoken about this issue. And he knows damn well what it means to be a parent and to protect your child. And I'm going to do that every frickin' day that I'm here in this committee when you bring up these ridiculous, barbaric bills that target trans kids.
Gentlelady's time has expired. The chair now recognizes the gentlelady from Wyoming.
First of all, we're not claiming kids are doing us harm. We are trying to protect them from harm. And protecting children is not inconsistent with our conservative philosophy. We are not mobilizing against our children. We are mobilizing to protect them. We are not demonizing children. We are trying to protect them from people who seek to use medical intervention to erase the essence of their very being. I want to remind the committee that this bill HR 3492 is actually an amendment to existing law, 18 USC Code Section 116, which was introduced by Representative Sheila Jackson Lee, and it was entitled Female Genital Mutilation. And the very purpose of it was to prohibit female genital mutilation. It was passed. It was a bipartisan bill that was passed. This is merely an amendment to that bill.
Would the gentlelady yield?
No, I'm not finished yet.
I wanted to ask you if you know what female genital mutilation is.
I am not finished. If you will remember at the time that this was brought forward in 2020 and even its predecessor in the 1990s, it was because of the issue of young girls, young women who were having, their parents were the ones who were taking them to have the female genital mutilation. So when you talk about this being a parental right to obtain medical intervention for their minor child, the very law, the very statute that we are amending specifically identifies and recognizes the fact that sometimes parents don't have the best interests of their children at heart, and that's why on a bipartisan basis in 2020 there was a law that was passed that made female genital mutilation illegal. So I want to make sure that people understand that that is the very purpose of the bill that we are considering as an amendment to an existing statute. I also want to point out that throughout history we have examples where the medical community has been so blatantly wrong in terms of the advice that they were giving. For example, in the 1930s, recommending that women smoke cigarettes, it will make them feel better while they're pregnant. We have the situation of the radium, recommending the use of radium, lobotomies from the 1930s through the 1950s. The gentleman who invented lobotomies actually received the Nobel Prize in medicine for that. We don't do lobotomies anymore. We recognize how barbaric that procedure is. Hormone replacement therapy without risk disclosures, forced coerced sterilization. We have a history of that. We just went through COVID-19, for goodness sakes. We had Anthony Fauci lying to us every which way from Tuesday about that masks are unnecessary and that we need to have masks and that you have to have the vaccine and the vaccine isn't going to cause any problems. And now we have all of the evidence demonstrating that the vaccines cause incredible medical problems for a certain subset of our population. Yet we were lied to over and over and over and over again just during COVID-19, and it was the medical field that did it. It's why there is such a distrust in the medical field right now. So when you talk about how there are these medical protocols and this is best practices, that's most likely based upon what is the Dutch protocol. The Dutch protocol that has been cited so many times by Democrats has been entirely discounted as being a situation where they actually cooked the books. You want to know how they cooked the books? According to a 2023 study, the premise of the Dutch study is flawed on account of 3 methodological biases that undermine the research. These include 1, dropping subjects from the study who experienced unsuccessful results. Number 2, altering the gender dysphoria scoring mechanism after the treatments were conducted in order to guarantee a significant post-surgical drop in gender dysphoria scores. And number 3, compromising findings of psychological benefits of hormone therapy by conflating the results of several treatments and factors such as gender reassignment therapy and psychological maturation. The results of this Dutch study have never been replicated despite the fact that there have been many efforts to do so. So when you talk about best practices, when you talk about the parents being the ones who get to make this decision and then attack us and make it as though we don't care about children, that we don't care about their well-being, the very purpose of this bill is to protect children from the people who would harm them through this type of medical intervention. With that, I yield back.
The lady yields back. The ranking member is recognized to speak on the amendment.
Thank you kindly. I rise to oppose the amendment. The gentlelady from Wyoming, I'm afraid, makes a series of arguments.
You're supporting the Jayapal.
Oh, we're still on the Jayapal amendment. I support very strongly the Jayapal amendment, and thank you, the gentlelady, for offering such an eloquent defense of it. But in answer to the criticism from the gentlelady from Wyoming. She makes a series of arguments that completely contradict her own position. She says, for example, that there have been all kinds of changes in our understanding of vaccines, which sounds like it would be an argument against having a national compulsory mandatory vaccine for everybody in the country, which of course we didn't have during COVID-19. But the logic of what she's doing today would lead us precisely to that, because it would say, let's let the federal government decide for everybody. If you don't want your kids to have the COVID-19 vaccine, too bad for you. The federal government now has the power to do it and is invited to do it, because they're saying that the United States House of Representatives and Marjorie Taylor Greene love your children more than you do. They are going to make decisions in the best interest of your child that you wouldn't make for yourself. We're going to leave it up to Marjorie Taylor Greene to do it. And that's just absolutely appalling. And so the gentlelady protests that they care about the kids more than those who would do them harm. I wonder who she's referring to, because she's got to be referring to the parents, because none of this happens without the authorization of the parents. In pretty much every state I'm aware of, I stand to be corrected if there's some state that gives it to some third-party body, but I think it's the parents who decide. But you want to overturn the authority of the parents to make medical decisions for their own children on the grounds that you're going to protect the children against the parents, which cuts completely against, I think, everything that you and other Republicans were saying about the vaccines. You didn't want government at any level, much less the federal level, deciding what was best in the best interest of the children. So this leads me to believe this profound, stunning contradiction that you don't really have the best interests of these children at heart. I'm much more drawn to what Ms. Jayapal has suggested in her amendment, which is we operate on the principle that parents are going to be acting in the best interest of the children. In fact, that's the standard in any family courtroom in the country when it comes to an award of custody. What's in the best interest of the children? And it's going to be one parent or the other, except in the most extreme and extraordinary case, right? So now Ms. Jayapal says, let the parents trust the doctors. The families that go through this question go right to the doctors and physicians and the psychiatrists to find out what is the best evidence available about what's going on. And now we take what is undoubtedly an extremely difficult situation, as all family medical situations are, and we compound it with the intrusion of the federal government for totally exploitative partisan purposes. And that is a scandal and an outrage. So let's give the families some room to make their own decisions. Let's let the states regulate medicine taking place within their own communities. Let's let the medical associations advise the state legislatures. And we don't need Big Brother doing this. If we want to help the families of America, let's not throw 15 million people off Medicaid. Let's not be slashing SNAP benefits and cutting child nutrition in the country. And I'll yield the remainder of my time to the offerer of the amendment, the distinguished gentlelady from Washington.
I thank the gentleman for yielding, and I wanted to just have a conversation with you, because also, if you noticed, and if we went back and looked at the transcript, the gentlelady from Wyoming actually said, we can't trust parents. In your comments, you said parents make decisions that are wrong for the kids. So I feel like you kind of answered the question for me about whether or not we should trust parents. And all of a sudden, the Republican Party, that was the party of saying limited government, we don't want you telling us what to do as parents, all of a sudden now, you are saying that you don't trust the parents. It's clear to me that you don't trust the medical establishment, even though every major medical organization, the American Medical Association, the American Psychological Association, the American Psychiatric Association, the American Academy of Pediatrics, all of these organizations are saying that this is care that is supported, and yet you're saying you don't trust them either. So I think what the gentlelady is saying is she's the only one that can be trusted to make the decisions. The Republican Party is the only one that can be trusted, because you can't trust the parents and you can't trust the medical associate. Is that your understanding as well?
I think we all have to trust Marjorie Taylor Greene is the point of the legislation here. I yield back.
Mr. Chairman.
Gentleman yields back.
Mr. Chairman.
The gentleman from Missouri is recognized.
Yes, Mr. Chairman, without objection, I would like to enter into the record a systematic review of outcomes of hormonal treatments in youths with gender dysphoria from the Karolinska Institute in Sweden.
Without objection.
The independent review of gender identity services for children and young people by Dr. Hilary Cass, also known as the Cass Review from the UK.
Objection.
And the treatment of pediatric gender dysphoria, review of the evidence and best practices from our own Department of Health and Senior Services dated May 1st, 2025, all of which refute the outdated, bogus, and methodologically biased so-called science embodied in the so-called WPATH and Dutch protocol. And finally, I'd like to introduce a consensus statement on the management of intersex disorders by Hughes et al., published in the Archives of Disease in Childhood. Too many times our Democrat colleagues like to conflate the idea of gender identity with these unfortunate children who have genetic sexual birth defects, and that likewise I would like to, without objection, enter into the record.
Without objection. The chair recognizes the gentleman from Alabama.
Thank you, Mr. Chairman. I'll yield to Ms. Hageman.
Thank you. I just want to read the current statute, 18 U.S.C. Section 116. Whoever knowingly, being the parent, guardian, or caretaker of a person who has not attained the age of 18 years, facilitates or consents to the female genital mutilation of such person. And then it goes on to say, shall be fined under this title, imprisoned not more than 10 years or both. Again, this was a bill that was authored by Representative Sheila Jackson Lee. So obviously, and it also goes on to say in subsection C, it shall not be a defense to a prosecution under this section that female genital mutilation is required as a matter of religion, custom, tradition, ritual, or standard practice. So obviously, Representative Sheila Jackson Lee recognized that there were circumstances under which the parents also could be actually guilty of doing things that were really not in the best interest and were very destructive to their children. So again, I'm just reading from 18 U.S.C.
Would the gentlelady yield?
In a moment, I will.
Okay.
18 U.S.C. Section 116, Representative Lee obviously recognized that there were circumstances where it was actually not only did she not trust the parents, she thought that they ought to be prosecuted for having their child doing female genital mutilation on their children. So when you say we don't trust the parents, for the most part, I do trust the parents, I do. But I think that there are also circumstances where I do not believe these kinds of life-altering decisions should be made by minors. As they are adults, that is a different circumstance, but we are talking here specifically about minors, and I think it's very important that we not conflate the two. So again, the existing statute that we are amending would fine and imprison parents for kind of the same thing. So with that,
would the
yes, I will
gentlelady
yield.
I would just wanted to know who, if the parents shouldn't make these decisions, who should? I mean, who gets to make the decision?
Well, the bill says that we cannot do these treatments on minors.
So no matter what a
the
parent
purpose.
thinks,
That's right.
this bill would not allow parents to make any decision about gender-affirming care as it relates to their children in consultation with their doctors.
It's specifically defined in the bill.
Yeah,
that's
so,
exactly
but for
right.
gender-affirming care, as you talk about
That's
it
exactly right.
in the bill, you're saying parents would not be allowed and would actually have to allow the federal government, would have to yield to the federal government, saying the federal government is going to make all these decisions about anything that qualifies as gender-affirming care.
Anything that's identified and
Right,
defined in this bill.
and are you aware that in gender-affirming care, are you aware of the things that are contained within gender-affirming care?
Yes, I am.
Okay, so you know that counseling and mental health is part of gender-affirming care, correct?
That's not what is, that's not what's forbidden in this bill.
But it is a part of gender-affirming care. You have a
That's
very
not what's
broad.
forbidden in this bill.
But you have a very broad.
That is not what's forbidden in this bill. Don't distort what's in the bill.
I'm not.
Don't argue with me by
Time belongs
distorting
to
what's
the
in the
gentlelady
bill.
from Wyoming.
So can I engage with another question here with you?
Yes, as
Okay,
long as
great.
you don't distort what's in the bill.
No, I'm not going to. I'm going to go back and find the references for what I'm talking about. You talked about female genital mutilation, but your own bill defines female genital mutilation as any procedure performed for non-medical reasons. So in your own bill, you are recognizing that medical procedures are not contained within the definition of female genital mutilation. And yet now you're expanding that definition. And I gotta say, if Sheila Jackson Lee were here, she would, I don't know how to recreate how she would be. I think she's probably rolling in her grave right now. God rest her soul.
Well, you know,
Because
she's
she
not here.
was
What I'm doing
talking
is
about
just
something
going on
very
what she wrote.
specific.
I'm
And-
just going on what she wrote.
But your own bill makes the distinction of what female genital mutilation is, and it doesn't apply to this. So
It's called,
I yield back.
the bill here is very clearly, genital and bodily mutilation of a minor, chemical castration of a minor. That is what is prohibited by this bill. That's what's
Okay.
prohibited. So you can't bring in all of these other things and pretend that they're in this bill, because they're not. That's what's in this bill. That's what this bill
The gentlelady
prohibits.
is actually the one who's bringing in a lot of things that are not contained in any medical definitions and assessments. In fact, you introduced definitions that we're not even sure where those came from. I yield, if the time is done.
Gentlelady yields back. Gentleman from Alabama yields back. Question occurs. Gentlelady from Vermont.
Thank you, Mr. Chair. You know, what I find in these conversations, and we've had these debates over transgender Americans repeatedly in this committee. And inevitably, it comes back to somebody on the other side of the aisle hurling invectives at us, saying that this is left-wing ideology. And I just want to bring us back to a hearing that we had on transgender Americans in this committee, in which sitting at the table there was a woman who identified as a conservative Republican Christian. That's how she self-identified. And she was saying to all of you who were on the committee at that time, it was last Congress, and she basically said, "Why are you up in my business? Why are you trying to make decisions for me and my child?" And earlier today, and I know we've been here a long time, earlier today, my colleague, Mr. Roy, said, you know, we shouldn't be busybody legislators all up in everybody's business. And he said, we already have too many damn laws. What are we doing here? And I'm just sitting here thinking about the courage that it took for that woman to come here to say to all of you, a Republican Christian conservative, that this actually isn't about politics. This isn't about party. This isn't about left-wing ideology. This is about her job as a parent, making sure she's getting the health care that her kid needs and deserves. And she was completely and totally open with us about the kind of despair that her child was in, the kind of anxiety and depression her child was racked with. And she said it was difficult for her. It was difficult for her and her family, especially in the community that they lived in, to stand with their child and to make this decision. And so I've just had it. I've had it with it constantly coming back to somehow that this is a Democratic issue. There are transgender people living in every single district here, and they identify as Republican and they identify as Democratic, and some of them don't vote at all because they can't stand that their government is being weaponized against them. So can we stop this nonsense? You want to have control over our conversations with our doctors. You want to meddle in the relationship that parents have with their child and with their doctors. And it is so difficult, week after week after week, for you to continue to attack such a small minority of people in this country that just want to live their lives. I don't know what the obsession is, honestly. Because I can tell you, the transgender people in my district, they don't want your help, member from Wyoming. They don't want your help. And their parents sure as hell do not want your help. They want to be able to make decisions in conjunction with their children's doctors. And I just find it so outrageous and insulting that you come here and you claim that this is about a partisan issue. It's not. It's about any child being able to get the health care that their parent deems is necessary to keep them alive. I do not know why, with all of the issues that we have in healthcare right now, from the price of insulin to the fact that we are rolling back all the work that was done on inhalers, to PBMs, to the fact that healthcare systems across this country are falling apart, that this is the topic, once again, that you choose to take up. It makes no sense that this is what we're spending our time at. And I can tell you, because I talk to parents, not just in my district, but who reach out to me who say, thank goodness someone is standing up for us in that committee, because once again, they're demonizing us and dehumanizing us and the language that they're using. Thank goodness you're standing up for us. They can't stand the fact that their own government is spending precious time in committee, once again, weaponizing government against them, and they just want to get the health care that they need and deserve. I yield back.
Back, gentleman from California is recognized.
Mr. Chairman, I've been pondering the question that the gentlelady from Washington posed. What would we not do for our children? That's an important question. Well, for one thing, we would not mutilate them. When I was 6, I wanted to be a pirate. I was fortunate enough not to have parents who would have removed a leg and an eye so that I could feel better about myself when I was a child. I don't think I would have felt the same way turning 18. So yes, parents are the fundamental custodians of their children. They have a fundamental right to make the decisions over their children's welfare, health, and upbringing. But there are certain things we don't allow parents to do. You can't starve your kids to death. You can't beat your kids to death. You can't withhold life-saving procedures from your kids. Such acts are considered child endangerment. And if you cross that line, society steps in to protect the basic welfare of the child. Now, that all changes at 18. We've decided as a society that at 18, you can now take control of your own welfare and your own future. Your parents no longer control your welfare, and as a society, we no longer act in place of your parents on these questions. At 18, you're a grown-up. If you want to be a pirate, you can be a pirate. All you have to do is find a doctor willing to take off your leg and poke out an eye. There are cases of grown-ups who choose to be lizards. They have their tongues split, their horns implanted, and all sorts of other mutilations that wouldn't be permissible even if the parents decreed it. But at 18, if you want to be a different sex than you are, you can be. At 18, these decisions pass to you. But until then, we give broad latitude to parents as long as their decisions do not imperil the life of the child or expose them to permanent life-altering deformations. And this is such a matter, and it stuns so many people that the Democrats can't see that. I yield back.
Gentleman yields back. Gentleman from Georgia is recognized.
Thank you, Mr. Chairman. I rise in opposition to the bill, and I also yield my time, or yield some time, to the gentlelady from Washington.
The question on the table is the amendment from the gentlelady from Washington.
Yes, which I know Mr. Johnson supports. Thank you so much for yielding. Mr. McClintock, I think you were saying that if a parent makes a decision for gender-affirming care in consultation with their kid's doctor, that could be considered mutilation. And I think the examples you gave don't reflect the reality, because you talked about beating kids and things that all the medical associations agree are abuse of kids. What you're doing is adding a word here, mutilation, to your perspective of what gender-affirming care is. That is just your perspective. It is not medically based fact. And I think you have to consider, and I think the Republican Party has to consider the struggle that you're having right now about the size and scope of government. And I think the conservatives are losing. You're certainly losing on the size of spending, because you kicked 16 million Americans off of health care, cut nutrition assistance by $300 billion, and set up massive cuts to Social Security. Also, you could give $5 trillion in tax breaks to the wealthiest billionaires and corporations, and oh, by the way, increase the deficit by trillions. And at least my friends Mr. Massey and Mr. Roy are consistent on this. But with this bill, you're really in very dangerous territory, because the party that believes in individual rights and parental rights wants big government to get right in there between a parent and their child's doctor and assign words that have no medical basis to procedures that you simply don't like. You don't like them. You don't want them for your kids. I get that. Listen, this was all pretty new to me when I first started to learn about it for my own family's personal reasons, and there was a lot to learn. And I would say to all the Americans out there, I empathize with something that is new and that Republicans are just doing everything they can to scare you. And so talk to people, read actual studies, don't listen to them. Like, go and research what gender-affirming care is. Find out that, first of all, it includes lots of things, and they are all care that has been approved by major medical organizations. And understand that surgery is a very tiny piece of it. That's what we've spent most of this time talking about on this committee. But at the core, this is a cruel, cruel campaign of misinformation, of fear-mongering, of distorting what healthcare looks like for a population that is less than 1/2 of 1% of all Americans. That's what we've spent this whole time talking about. And so I want to go back to what my amendment would do. My amendment would allow medical professionals to continue delivering health care to young trans people when it is considered a best practice. And my amendment recognizes that that care is safe, it's widely accepted, it's appropriate, it's medically necessary, and most importantly, it allows transgender people to live safely and authentically. Now, I can tell you for a fact that these decisions about care in trans families are made really thoughtfully and with a lot of debate and discussion and deliberation. And all of the trans young people that I know, and I know many of them, go through months or years of consultations with their parents, with their medical providers, before they're even able to access care. And there is no standard of care out there that recommends any medical interventions before puberty. So I would just say to people who are afraid, I understand why you're afraid, because my colleagues on the other side are doing everything they can to make you afraid and to try and blame trans kids for every woe that you face. And let me tell you, trans kids did not raise your rent. Trans kids did not make your grocery prices go higher. Billionaires did. Millionaires did. Republicans who continue to funnel tax breaks to those people did that. So just leave our kids alone and let parents make the decisions that they need to make about their kids' health care with their doctors, by themselves, without big government making those decisions for them. I yield back.
Gentlelady yields back. The question occurs on the amendment offered by the gentlelady from Washington. All those in favor will say aye.
Aye.
Those opposed, no. No. In opinion of the chair, the noes have it, and the amendment is not adopted.
Could we have a recorded vote, please, Mr.
Recorded vote being requested. The clerk will call the roll.
Mr. Jordan?
No.
Mr. Jordan votes no. Mr. Issa? Mr. Biggs? Mr. Biggs votes no. Mr. McClintock? Mr. McClintock votes no. Mr. Tiffany? Mr. Massey? Mr. Massey votes no. Mr. Roy? Mr. Fitzgerald? Mr. Klein? Mr. Klein votes no. Mr. Gooden? Mr. Van Drew? Mr. Nels? Mr. Moore? Mr. Moore votes no. Mr. Kiley? Ms. Hageman? Ms. Hageman votes no. Ms. Lee? Mr. Hunt? Mr. Fry? Mr. Grothman? Mr. Grothman votes no. Mr. Knott? Mr. Harris? Mr. Harris votes no. Mr. Onder? Mr. Onder votes no. Mr. Schmidt? Mr. Schmidt votes no. Mr. Gill? Mr. Baumgartner? Mr. Raskin? Mr. Raskin votes aye. Mr. Nadler? Mr. Nadler votes aye. Ms. Lofgren? Mr. Cohen? Mr. Johnson? Mr. Johnson votes aye. Mr. Swalwell? Mr. Liu? Ms. Jayapal? Ms. Jayapal votes aye. Mr. Correa? Ms. Scanlon? Mr. Neguse? Ms. McBath? Ms. Ross? Ms. Ross votes aye. Ms. Ballant? Ms. Ballant votes aye. Mr. Garcia? Mr. Garcia votes aye. Ms. Kamlager-Dove? Ms. Kamlager-Dove votes aye. Mr. Moskowitz? Mr. Goldman? Ms. Crockett? Mr. Issa, you're not recorded. Mr. Issa votes no. Mr. Chairman, there are 8 ayes and 12 noes.
The amendment is not adopted. Who seeks recognition? Gentlelady from Vermont is recognized.
I have an amendment at the desk, Mr.
Clerk
Chair.
will report. Point of order reserved by the gentleman from Arizona.
Amendment to the amendment in the nature.
Without objection, the amendment be considered as read. The gentlelady from Vermont is recognized to explain her amendment.
Thank you, Mr. Chair. I want people to understand what's going on here today. My colleagues on the other side of the aisle are continuing their obsession with being in your kid's pediatric appointment. I find it insulting and creepy. And it's astonishing that we are allowing this even to come before the committee today. It's an attempt to interfere with your healthcare decisions for your kids. Essentially, what's going on here is they want to criminalize healthcare. These are decisions that should be made by doctors, by parents, by trans young people, not by, with all due respect, by Mr. Jordan, the chair of the committee, or by any other member of this committee. And we've been in this committee hearing today talking about the incredible amount of federal crimes on the books, and yet we are sitting here talking about adding another one for no good reason. As I alluded to earlier, this has absolutely no business in front of the committee. We have other really important work to do here, whether it's on prescription drugs, whether it's on lowering the cost of insulin, or, as my colleague said from the state of Washington, pushing back against incredible corporate greed and corruption in healthcare. These are all things worthy of our attention. In fact, these are the things that our voters want us to be focused on. But once again, no, we are here. We are beating up on trans kids and their families, and we are trying to criminalize doctors and parents. My amendment strikes the bill's prohibition on providing health care to trans youth. That's what we're talking about. We do not need to be criminalizing doctors or parents for doing what they feel like is in the best interest of the child. We need to be focused on things that our constituents are clamoring for, which is protecting Medicaid, which is making sure people have health care and food assistance. And it's frankly pretty incredible that we're here today doing this just a few weeks after, as far as I can tell, every single member except for Mr. Massey over there voted to kick some of their constituents off Medicaid and by extension shut down rural hospitals as they lose those Medicaid dollars. And if you think that we won't all be impacted by massive cuts to Medicaid, you're wrong. It will impact the doctors, the hospitals, the communities. And this isn't new. We know that this is something that President Trump went after in his first term, proposed cuts to Medicaid. That was the plan. It continues to be the plan. And if you think you won't be impacted by Republicans wanting to make medical decisions for your kids and for your family, you're wrong too. My Republican colleagues have no business being in the doctor's office with your kid. Now, this bill is an attack on parents and doctors and on kids. This bill would throw parents in jail if they help their transgender child access evidence-based treatments. Throw doctors in prisons for providing medically necessary life-saving care to transgender youth, care supported by every major medical association in the United States, and strip parents of their right to make medical decisions about their own kids' health care. I mean, really. This is what requires our attention today. We've sunk this low. We've sunk so low to jailing parents for trying to do what's right for their kids. Parents and doctors already have to worry about state laws banning medical care for trans kids. This bill would introduce the risk of federal criminal prosecution for basic medical care. And let's not forget the hypocrisy of all of this, the hypocrisy of banning medical care for trans kids while permitting that very same care for everyone else. Apparently, my Republican colleagues don't have a problem with puberty blockers or hormone therapy, only with the trans people who need them in order to live. It's cruel, as many people have said today, it's cruel. And there's no medical evidence behind this bill. It is hatred, it is bullying, and it's rotten through and through. And this amendment strikes at one of the worst aspects of this truly reprehensible piece of legislation, and I urge my colleagues to support my amendment and keep Republican congressmen and women out of your kid's doctor's office. I urge a yes vote on my amendment, and I yield back.
Gentlelady yields back. Gentlelady from Wyoming is recognized.
Just very quickly, this bill does not add a new crime. It just simply amends an existing statute, as we've already talked about. And if you're going to use the word creepy, I think it's pretty fair to define as creepy bodily mutilations and chemical castration of minors. It doesn't prevent counseling. It doesn't prevent other treatment for so-called transgender youth, but it does prohibit bodily mutilations and chemical castrations, something that I believe many people, in fact, I'd say 80 to 90% of the people in this country agree with, but most specifically, I know that we have the support of Prisha Mosley, Chloe Cole, Amelia Schmidt, Laurel Herbert, Per Joseph, Annika Biggles-Lyson, and Simon B. and Maya Price, all of whom signed this letter. I would ask unanimous consent for putting this letter in the record.
Without objection.
This is a letter from folks who have detransitioned after having gone through some of the things that we're talking about. With that, I yield back.
Gentlelady yields back. Gentlelady from California is recognized.
Thank you, Mr. Chair. I want to support this amendment and speak to the underlying bill. You know, I love the title, Protecting Children's Innocence Act, because what a misnomer that is. You know, the bill does just the opposite. You actually protect a child's innocence by not bombarding them with adult ideology and ignorance and immoral calcification. Why don't we let our children figure out who they are on their own without us inserting our judgments onto them? How about this? Why don't we love our kids? Why don't we love our kids and trust their parents to let them figure out who they are, who they want to be in this world? I am struck by the fact that we're actually talking about genital mutilation and trying to prevent that from happening when, hey, we were trying to do that in our Foreign Affairs Committee with USAID, because there is real genital mutilation happening on young girls, mostly young girls, in other countries around the world. But you know what? We cut that funding, pun intended, and yet we're here talking about it. When this is something, I mean, if it was so prevalent that young kids were being snatched and taken into doctors' offices and all these crazy medical things were happening to them without their parents' consent, That would be on the news 24/7. And it's not happening. This bill is continuing to push a false narrative about something that, quite frankly, we should be talking about, the cuts that Republicans just passed to the medical community. You know, we're going to be dealing with hospitals and doctors closing their doors because of the cuts that you all passed. We're going to be dealing with our grandmothers not being able to get their Medicaid benefits because of what you just passed. You know, what about folks who are trying to get fertility treatments? Well, they're not going to have access to any of that because of what you all have been doing. And then how is any of this going to be interpreted or even enforced? We have been ricocheting in this committee today around states' rights. You know, it's wholly inconsistent. 2 weeks ago, like no states' rights when you want to have a national, carry law, everybody can get a gun, boom, boom, shoot them up. And then it's state laws, only I guess when it fits your narrative. This right here should not be debated in this committee. It should be left to states, and it should be left to the parents. There are legions of young people who are living in a gray area as they figure out who they are. Heck, there are legions of adults and even some congressmen and women living in the gray area. Give them space, but don't criminalize them or prevent them from getting the medical attention that they need. This bill goes after children and their parents and medical professionals. And then how does this thing get enforced, get interpreted? I mean, are we going to have goon squads? Are you going to have troops stationed at doctors' offices or in schools and therapists' offices, yanking down kids' pants to see what they've had done or what they're preparing to have done? I mean, what kind of world are you trying to create and force us to live in? I don't want you in my life. You probably don't want me in yours, which is why we shouldn't even be debating this bill, let alone passing this bill. And let me just say something else. I have run into so many members of the trans community, young people, adults, and you know where we meet? We meet in church. We meet at the farmers markets. We meet in the parks. We meet at family reunions. We meet in the grocery stores. And we are all talking about the same things: how we can live our own lives without people that we don't know, without people that we know want to harm us, who don't love us or care about us, coming up with crazy definitions about what a male is and what a female is. We want to live without that in our lives. So vote yes on the amendment and no on the bill. And with that, Mr. Chair, I yield back.
Gentlelady from Washington is recognized.
Thank you, Mr. Chairman. I want to thank my colleague, Representative Ballant, for introducing this amendment that I think makes it clear the most common types of care young trans people receive are safe and medically necessary. And so I would once again turn to the American people and ask you, do you think that you or your doctor should be locked up for getting the care, getting your child the care that they need? For all the talk from the other side about big government staying out of people's lives, they want to get between you and your doctor. That's what this bill is about. This is Republicans in Congress forcing their way into your doctor's office and telling you that they know better than you, the parent, better than your doctor, about what medical care is appropriate for your child. And by the way, if you disagree with them, this bill allows them to lock you up for 10 years. And listen, if they can do this on this issue, they can do it on any issue. They can get between you and your doctor on any issue. And I'll go back to the truth that most U.S. medical organizations, through lengthy, independent review processes, back gender-affirming care, which normally involves therapy, puberty blockers, and hormone therapy. And let's remember too, as I said before, just because I think we got to repeat these things, trans children make up around 2% of minors in the United States. And out of this already very small population, only 11% are even prescribed hormone therapy. And that's with the advice and consent of parents and doctors. So we're literally over and over again talking about this tiny fraction of kids here, instead of talking about anything that's going to help your lives. For the vast majority of trans youth, care comes in the form of puberty-pausing medications. And I bet if I were to go through and do a little survey of all my colleagues on the other side and ask you to define what these are, you wouldn't be able to tell me. I bet you wouldn't be able to tell me, and feel free to come up and tell me later. Maybe the doctor on the front row would. These medications have been prescribed safely for both non-transgender and transgender kids for decades to treat a whole range of issues. They're well-researched, they're standard clinical care, and trans patients use them at exactly the same doses and for exactly the same reasons as their non-transgender counterparts. So this isn't like crazy treatment that's only used for one small group. This is actually treatment that can be used by everybody. And let's be clear, while the effects of these medications are reversible, puberty can have irreversible effects on a young person's body. And these life-saving medications prevent trans young people from going through the wrong puberty and preserve their ability to make a choice down the road without any permanent impact to the body. Gender-affirming surgery, which we talk about a lot in all kinds of ways here on this committee, is so rare that a child in America is more likely to die from a gunshot wound than to receive that care. And I don't see a single bill being brought up in this committee that tackles the epidemic of gun violence against young people. To make this point abundantly clear, I want to read a testimonial from a parent of a trans child on what this care means to them. Alana says, "If not for the support and care my 14-year-old doctor received over the past 3 years, she might not be alive today. Before beginning gender-affirming care, my daughter would cry herself to sleep, feeling disconnected from her body and from herself. She often expressed a desire not to live and was overwhelmed by feelings of despair and alienation. Her mental health was fragile, and she seemed lost in a sea of confusion and pain. It was heartbreaking to witness her suffering and to realize how much she needed support. Since starting gender-affirming care, everything has changed. My daughter now presents fully as herself, confident and authentic. She is an engaged student and actively participates in band, roller derby, and cherishes her friendship. She has blossomed into a joyful, resilient young person who embraces her identity and her future. Her experience is a testament to the transformative power of acceptance and appropriate medical care, and it is a reminder that every young person deserves the chance to live authentically and happily." I proudly support your amendment, Ms. Ballant, and I yield back.
Gentlelady yields back. The question now occurs on the amendment offered by the gentlelady from Vermont. All those in favor say aye. Aye. Those opposed, no. No. In the opinion of the chair, the noes have it. The amendment is not agreed to. Roll call being requested by the ranking member. The clerk will call the roll.
Mr. Jordan?
No.
Mr. Jordan votes no. Mr. Issa? Mr. Issa votes no. Mr. Biggs? Mr. Biggs votes no. Mr. McClintock? Mr. McClintock votes no. Mr. Tiffany? Mr. Massey? Mr. Massey votes no. Mr. Roy? Mr. Roy votes no. Mr. Fitzgerald? Mr. Klein? Mr. Gooden? Mr. Van Drew? Mr. Nels? Mr. Moore? Mr. Moore votes no. Mr. Kiley? Mr. Kiley votes no. Ms. Hageman? Ms. Hageman votes no. Ms. Lee? Mr. Hunt? Mr. Fry? Mr. Grothman? Mr. Grothman votes no. Mr. Knott? Mr. Harris? Mr. Onder? Mr. Onder votes no. Mr. Schmidt? Mr. Schmidt votes no. Mr. Gill? Mr. Baumgardner? Mr. Baumgartner votes no. Mr. Raskin? Mr. Raskin votes aye. Mr. Nadler? Mr. Nadler votes aye. Ms. Lofgren? Ms. Lofgren votes aye. Mr. Cohen? Mr. Johnson? Mr. Johnson votes aye. Mr. Swalwell? Mr. Liu? Ms. Jayapal? Ms. Jayapal votes aye. Mr. Correa? Ms. Scanlon? Mr. Neguse? Ms. McBath? Ms. Ross? Ms. Ross votes aye. Ms. Ballant? Ms. Ballant votes aye. Mr. Garcia? Mr. Garcia? You're not recorded. Mr. Garcia votes yes. Ms. Kamlager-Dove? Ms. Kamlager-Dove votes yes. Mr. Moskowitz? Mr. Goldman? Ms. Crockett? Ms. Crockett votes yes. Mr. Klein? Mr. Klein votes no. Mr. Fry? Mr. Fry votes no.
Clerk will report.
Mr. Chairman, there are 10 ayes and 15 noes.
The amendment is not agreed to. Who seeks recognition?
Mr. Chairman, I have an amendment at the desk.
Reserved point of order, Mr. Chairman.
Point of order reserved by the gentleman may state his, or excuse me, the clerk will report.
Amendment to the amendment in the nature of a substitute.
Without objection, the amendment will be considered as read. The gentleman is recognized to explain his amendment.
So, genital mutilation is abhorrent. I'm against it. I know that the author of this bill has the best intentions. But I'm concerned that the interstate nexus, as it's painted here, is overly broad. It may not even hold up in courts. And so what I'm trying to do here with this amendment is tighten the definition of the interstate nexus such that we have a legitimate federal role here. Child abuse is the subject of state law. If you abuse a child, you're breaking state laws and you go to a state court. And we are here at the federal law trying to prevent something from happening, which, without a federal nexus, is the venue of state law. So there are instances where there can be a federal nexus, where this would be a legitimate legislative exercise, and that would be if we were legislating for the District of Columbia, territories or possessions of the United States, special maritime and territorial jurisdictions, somebody who's working for the federal government, for instance, that would be the second federal nexus. There's 4 that I'm prescribing here in this amendment. Instead of, in the bill itself, there's several nexuses, including if you used an instrument that had traveled in interstate commerce. Let's say a scalpel, not to be too graphic here. But there's almost no way to avoid the federal nexus as it's drafted here. So it's really, the bill itself acknowledges federalism and the 10th Amendment, but then it draws the federal nexus so broadly that it ignores federalism in the 10th Amendment. So in any case, getting back to the sections where I do believe we have federal jurisdiction, it would be any of the federal territories, it would be any individual working for the federal government or under color of federal law. It would be if the procedure was performed by an individual entity or institution receiving direct federal funding, such as Medicaid, Medicare, or involving the transportation of a minor across state lines for the purpose of performing genital or bodily mutilation or chemical castration. This mirrors the language, if you go and look at federal laws that exist on the books, how they come up with a federal nexus for sexual exploitation, for pornography. The pornography has to be involved, actually be transported across interstate lines. But this is more analogous to sexual abuse which involves, or rape, of a minor, which has to involve transportation of the minor across state lines. Again, I think it's a good bill. I'm glad that it acknowledges that there has to be a federal nexus. I think the federal nexus that's drawn here in the bill itself is too broad and doesn't mirror the legislation that's on the books, analogous legislation. And so that's why I'm offering this amendment to tighten the language. And with that, I yield back. I would also add, let me just say, we often don't get into, try not to assign motives to our colleagues, so I'll assign my own motive here to why I'm offering this amendment. I can't vote for the bill itself unless it's modified in this way, and so in good faith, I have to offer a way to fix my objection. This is the objection I have, and this is the fix that I propose.
Gentleman insists on his point of order.
Yeah,
The question is on the amendment offered by the gentleman from Kentucky. All those in favor?
Mr. Chairman.
No, all those in, I'm just calling the roll. I didn't think you guys would. All those in favor say aye.
Mr. Chairman, I want to discuss the amendment.
Gentleman's recognized.
I just want to agree with the gentleman from Kentucky. We can sit here and we can go into great detail, as everyone on this committee, particularly on this side of the aisle, knows, about the abuse under the Commerce Clause of federal power. And as a party that stands for the proposition of limited government, we are careful about the use, or we should be careful about the use of the Commerce Clause to carry out the power of the federal government and to create crimes. And so here we're talking about the language that is always used in terms of the instrumentalities of commerce and so forth, which is typically used to be able to use the Commerce Clause to apply the power of the federal government against the state or actors within a state. So here, what the gentleman from Kentucky is doing is trying to outline what he believes is appropriate nexus, as he used the term, which is the territories in the District of Columbia, as well as children who have crossed state lines, and then another category about those hospitals or healthcare providers that are taking federal dollars. Now, I think that is a better approach. I think it is important for us to recognize that we have now, since Wickard v. Filburn, we have abused the Commerce Clause so much as to eliminate any recognition at all of the balance of power between the federal government and the state government. And that is the point. And we've all been guilty of it. It's the same thing that Republicans do when we campaign on balanced budgets and come here and spend money we don't have. It's the same thing that we do when we go out and try to talk about limited government, when we then vote for all of the laws and all of the regulations and all of the rules that we then campaign against. So here, what we're trying to do is tighten down and acknowledge the truth, which is that we are all aghast at what we're talking about with respect to these policies. Chloe Cole sat at that table and testified in this room to this committee, might have been the subcommittee, in explaining the extent to which her life was turned upside down by these horrific procedures. These procedures should be outlawed. These procedures on minors are grotesque, and the doctors that carry them out should be ashamed. And the doctors that are carrying them out, often against state law and using funds they shouldn't use, should be ashamed. But at some point, we in this committee have got to be the guardians of the Constitution and the limits of the power of the federal government and how it is used. And so we should focus and target the use of that power, especially and carefully. That is why this amendment is being offered, and that's why I support the amendment being offered by the gentleman from Kentucky. And yield back, or you want to think? And I now yield back.
Gentleman is back. Gentleman from Maryland is recognized.
Thank you, Mr. Chairman. Well, the gentleman presents us with a bit of a dilemma here, because we think that the whole bill is a dreadful invasion of the regulatory authority of the states, the medical boards and commissions in the states, and the families and the parents who should be making these decisions under our constitutional system of government, where the people have rights guaranteed to the people and the states under the 9th and 10th Amendments. Nonetheless, I would say that the gentleman's amendment does narrow the bill significantly, I think, because there will be some people who will actually be able to make decisions for their children still after this amendment, and there will be some people, some hospitals and doctors who will be able to continue to practice the best practices of the profession. I wish that the gentleman from Texas would go all the way when it came to COVID-19. He said the American people are fully capable of making an educated decision about whether they want to get the vaccine or not, but under the logic of this bill, which he seems to be supporting, it would be fine for the federal government to say, at least where there's a federal nexus as defined by the gentleman, that we're going to override the judgment of the parents and say it's in the best interest of the kids to get the COVID vaccine, or in a hypothetical perhaps a bit closer to home, get the measles vaccine. We lost 1.2 million people in COVID-19. We've lost millions of people to measles. I think there's a much better argument for that. We're not talking about putting other people at risk and danger because of a contagious disease. This is a decision for the family itself. And yet, you want to override all of the decisions of the family, the best wisdom of the medical profession, the state boards, and the state laws to do this. But having said that, my friend Mr. Roy at least makes a gesture at trying to torture out some kind of federal nexus to the conduct that is being proscribed here. I'm not quite sure why the District of Columbia is treated like a federal enclave. It's not a federal enclave. It's the district that's the seat of government. And I wonder if he would in the future extend the logic of applying a nationwide mandate to anybody getting federal funding. Nonetheless, I'm going to go ahead and vote for this. I'll leave it to the judgment of my colleagues whether they will want to, but I do think that it narrows the scope of this really terrible bill.
We have votes called on the floor. The question occurs on the amendment offered by the gentleman from Kentucky. All those in favor say aye.
Aye.
Those opposed, no.
No.
In the opinion of the chairs, the noes have it.
Can we record a vote, please, Mr. Chair?
Recorded vote being requested. Clerk, call the roll.
Mr. Jordan?
No.
Mr. Jordan votes no. Mr. Issa? Mr. Issa votes no. Mr. Biggs? Mr. Biggs votes no. Mr. McClintock? Mr. McClintock votes no. Mr. Tiffany? Mr. Massey?
Aye.
Mr. Massey votes aye. Mr. Roy?
Aye.
Mr. Roy votes aye. Mr. Fitzgerald? Mr. Klein? Mr. Klein votes no. Mr. Gooden? Mr. Van Drew? Mr. Nels? Mr. Moore? Mr. Moore votes no. Mr. Kiley? Mr. Kiley votes no. Ms. Hageman? Ms. Hageman votes no. Ms. Lee? Mr. Hunt? Mr. Fry? Mr. Fry votes no. Mr. Grothman? Mr. Grothman votes no. Mr. Knott? Mr. Harris? Mr. Harris votes no. Mr. Onder? Mr. Onder votes no. Mr. Schmidt? Mr. Schmidt votes no. Mr. Gill? Mr. Gill votes no. Mr. Baumgartner? Mr. Baumgartner votes no. Mr. Raskin?
Aye.
Mr. Raskin votes aye. Mr. Nadler? Mr. Nadler votes aye. Ms. Lofgren? Ms. Lofgren votes aye. Mr. Cohen? Mr. Johnson? Mr. Johnson votes aye. Mr. Swalwell? Mr. Liu?
Votes now.
Ms. Jayapal? Ms. Jayapal votes aye. Mr. Correa? Ms. Scanlon? Mr. Neguse? Ms. McBath? Ms. Ross? Ms. Ross votes aye. Ms. Ballant? Ms. Ballant votes aye. Mr. Garcia? Mr. Garcia votes aye. Ms. Kamlager-Dove? Ms. Kamlager-Dove votes aye. Mr. Moskowitz? Mr. Goldman? Ms. Crockett? Ms. Crockett votes aye.
Clerk will report. We already won. It doesn't matter. We already won.
Mr. Knott? Mr. Knott votes aye.
Mr. Knott? Mr. Knott?
You gotta call the freaking roll. Clerk will report. Clerk will report. Votes are in.
Mr. Chairman, there are 13 ayes and 15 noes.
The amendment is not agreed to. We will stand in recess, come back for hopefully vote on final passage while we go vote on the floor.
We could voice.
We got anything? Oh. No, you guys got done with amendments? Let's. Question occurs on the on the amendment in the nature of a substitute. This will be followed by a vote on the amendment on the final passage. Clerk will call the roll.
The question occurs.
Question occurs. All those in favor say aye. Aye. Those opposed, no.
No.
Opinion chairs, the ayes have it.
The ANS is adopted.
ANS is adopted. The question now occurs.
We recorded that on that. On the ANS. Oh, no.
On the final bill? Yeah. Okay. Question now occurs on the final bill. All those in favor say aye. Those opposed, no. Opinion chairs, the ayes have it.
Recorded vote, please.
Clerk will call the roll.
Mr. Jordan?
Yes.
Mr. Jordan votes yes. Mr. Issa?
Yes.
Mr. Issa votes yes. Mr. Biggs? Mr. Biggs votes aye. Mr. McClintock? Mr. McClintock votes aye. Mr. Tiffany? Mr. Massey? Mr. Roy? Mr. Fitzgerald? Mr. Fitzgerald votes aye. Mr. Klein? Mr. Klein votes aye. Mr. Gooden? Mr. Van Drew? Mr. Nels? Mr. Moore? Mr. Moore votes aye. Mr. Kiley? Mr. Kiley votes aye. Ms. Hageman? Ms. Hageman votes aye. Ms. Lee? Mr. Hunt? Mr. Fry? Mr. Fry votes aye. Mr. Grothman? Mr. Grothman votes aye. Mr. Knott? Mr. Knott votes aye. Mr. Harris? Mr. Harris votes aye. Mr. Onder? Mr. Onder votes aye. Mr. Schmidt? Mr. Schmidt votes aye. Mr. Gill? Mr. Gill votes aye. Mr. Baumgartner? Mr. Baumgartner votes aye. Mr. Raskin? Mr. Raskin votes no. Mr. Nadler? Mr. Nadler votes no. Ms. Lofgren? Ms. Lofgren votes no. Mr. Cohen? Mr. Johnson? Mr. Johnson votes no. Mr. Swalwell? Mr. Liu? Ms. Jayapal? Ms. Jayapal votes no. Mr. Correa? Ms. Scanlon? Mr. Neguse? Ms. McBath? Ms. Ross? Ms. Ross votes no. Ms. Ballant? Ms. Ballant votes no. Mr. Garcia? Mr. Garcia votes no. Ms. Kamlager-Dove? Ms. Kamlager-Dove votes no. Mr. Moskowitz? Mr. Goldman? Ms. Crockett? Ms. Crockett votes no. Mr. Chairman, there are 17 ayes and 10 noes.
Members will have 2 days, to submit views without objection. The bill report is a single amendment in the nature of a substitute, incorporating all adopted amendments, and staff is authorized to make technical and conforming changes. Gentleman from Wisconsin wanted to make a statement. Gentleman is recognized.
Yeah, on this bill, I got here a little late, said another hearing. I don't understand, and I hope we change this before it hits the floor. In our society, a lot of times we say things has to be done at 18, sometimes 21. This should be age 55, but if we're gonna pick between 18 and 21, I don't know who would say this is appropriate for a 19-year-old. So I hope we change it to 21 when it gets to the floor. Thank you.
Gentleman yields back. This concludes the committee's business for the meeting. The meeting is adjourned.